Well, I know one thing I think we talk about in healthcare quite often is, and I'd like to hear your opinion, is, lack of transparency. Many times when you go in, if you have insurance, you go into a hospital or you go into a doctor's office, you have no idea what it's going to cost. So, lack of transparency. And many times, months later, you get a bill that's completely out of left field and it was kind of a surprise. So, what you're doing is
Mhm.
completely opposite of that. No surprises and transparency up front.
Yeah, it's been a personal experience of mine where I go in to see a doctor, not knowing exactly what the fees are going to range. Is it going to be $50? Is it going to be $5,000? I have no clue, but the care is needed. So I go in, and 6 months later, I get a bill. Actually, I got a bill 9 months later after taking my daughter to a pediatrician. And then I look at the price tag, and I'm sticker shocked. I had no ability to choose, so I couldn't even say, well, let me doctor shop around and see if it's within my budget. There was no freedom for that. I felt so constricted with the insurance plan that I had, and that was the only option that was provided. I felt hijacked. And at the end of the day, it's the insurances don't have a face. It's the doctor that we interact with that we take our frustrations out. So I can see that as a patient, and I understand that as a doctor as well.
We are actually in the process of making a video on what if hotels build like hospitals. And it's basically, imagine if you checked into a hotel and they didn't know what the price was going to be.
Mhm.
And imagine, like you were talking about, your pediatrician sending you a bill 9 months later. We wouldn't accept that at a hotel.
Right.
Why should we accept it with healthcare?